Hello everyone, welcome back to my channel. In this podcast, I'm going to deal with homeopathic therapeutics for the disease abscess. So let's get started. As I already mentioned in my previous therapeutic podcast, I'm going to follow a sequential order but in the reverse way so that it can be memorized and understood very easily. So let's get started. Coming to the first remedy for abscess is sulfur. In cases where sulfur is suitable, is like where the skin is dry, scaly, unhealthy, and when every little injury suppurates, there is itching and burning, which is very much aggravated by scratching, and pruritus from warmth in evening is seen in such cases wherein abscess produces or abscess exhibits such characteristics. You can think of sulfur. It is also helpful in starting like sulfur is helpful in the cases to start in chronic cases and in ending the acute cases. So keep in mind that if there is chronicity in the abscess formation, it's very ideal. If the symptom similarity is there, it is very ideal to start the treatment with sulfur. And if it is an acute one, after giving according to the symptom similarity, you can end the case with the help of sulfur when it is an acute situation. So that's about sulfur in abscess conditions. And the next remedy is silesia. There are phelons, abscesses, boils, old fistulous ulcers, offensive pus, and every little injury suppurates, itching in daytime and evening. And silesia fastens the formation of pus in the abscess and boils, and also it's helpful in the treatment of recurrent boils. Some people tend to exhibit this inborn tendency of recurrence of boils or abscesses. You can think of silesia in such cases. And next comes is the remedy rustox, which is very least thought of, but it do have some affinity in the cases of abscess, especially when the skin is red and swollen and there is intense itching. And it's helpful in the very early stages of cellulitis, that is inflammation of the skin. When there is inflammation of the skin along with the abscess formation, you can think of rustox. And in infections and carbuncles where there is not much pus formation is observed, that means abscess is said to be a closed collection of pus in anywhere in the body. But rustox is suitable in situations when there is abscess formation but very minimal pus, and when a large area of skin is involved and there is redness, swelling of the skin. In such cases, you can think of rustox. And the next remedy is nitric acid. The ulcers or abscess or skin affections that are in areas where mucous membrane and skin meet, that is at the outlets of the body, and wherein there is easy bleeding from the abscess. Generally when the abscess is drained out, there is oozing of pus followed by that of discharge of excessive amounts of blood. And when there is draining of very little amount of pus followed by excessive bleeding, and especially at the outlets of the body, that is in and around the mouth or in and around the anus, vagina, urinary tract, in and around the eyes, nose, etc., you can think of nitric acid, and which are bleeding and which tend to bleed very easily. That means even on touch also they tend to bleed. So in such cases, you can think of nitric acid. Coming to the next remedy, that is lachesis. There is hot perspiration and there is bluish purplish appearance of the skins. And like in abscess, when there is appearance is almost like bluish purplish kind of thing, you can think of lachesis. And also in boils and carbuncles with purplish appearance forms the keynote symptom, wherein lachesis is helpful and can be thought of. Coming to the next remedy, Merxol. there is tendency to formation of pus, and skin is constantly moist, which is a very 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 important symptom. If there is in abscesses, when there is the skin is dry, the previously told remedies can be thought of like sulfur, silicea, etc. But when there is constant moisture on the skin, you have to think of Merck salt, which is a very very important symptom. And there is constantly moist, but still it's constantly moist, and persistent dryness of skin contraindicates mercurius. That means if there is any sign of the dryness of the skin, you should keep Merxol away from your mind. And there is generalized tendency to free perspiration, but patient is not relieved thereby. Even after perspiration, patient doesn't feel any relief. And itching is aggravated from warmth of bed in Merxol. So yeah, in abscesses wherein these symptoms are fulfilled, you can think of Merxol. And the next remedy is Hepar's sulph, and there is tendency to suppuration in it, which is also seen in the sulfur, silicea, etc. But definitely the clear cut differentiations are present in the selection, which help us in the selection of Hepar's sulph. And the tendency to suppuration is most marked. Unhealthy skin and every little injury suppurates. Ulcers very much sensitive to touch and cannot bear to be uncovered. And there is an important symptom wherein the patient doesn't allow anyone else to touch the abscess or the affected part of the skin. And but they don't, they're not okay to be touched, as well as they can't bear to be uncovered, as they are very very there is hypersensitiveness in Hepar's sulph. And a very important point is, when given in higher potencies, Hepar's sulph aborts, means it stops the formation of pus, whereas in given in lower potencies, hastens, that means it fastens the process of pus formation, thereby fastens up the procedure and helps in breaking out of the pus from the abscess easily. So in such cases, you can think of Hepar's sulph when there is excessive sensitiveness. Coming to the next remedy, that is carbolic acid. There are itching vesicles with burning pain. Burns tend to ulcerate, and there is offensive foul discharge, or the pus which is discharged from the abscess is foul in nature and it's very offensive. And a very prominent symptom is physical exertion brings on or produce abscess somewhere on the body, which is very very prominent symptom. Any sort of physical exertion, if resulting in formation of abscess anywhere in the body, carbolic acid is your remedy. Coming to the next point, next remedy is calcareous sulph. Any skin damage, cuts, wounds or bruises is unhealthy, and they tend to suppurate, and there is discharging of pus. They do not heal readily. Many little matterless pimples under hair, bleeding when scratched. So if there is any delayed healing process, you can think of calcareous sulph. And there is repetitive tendency, and you find patients saying that before one boil or abscess heals, you find another one. So such is explanation given by the patient when you can think of calcareous sulph. And coming to belladonna, the skin is excessively dry and hot, and it's swollen and it's very very sensitive. And it feels very smooth, though it is dry, as it is glistening appearance. As such, it is given like scarlet like, which means very much red, and suppurative wounds. And there is alternate redness and paleness of the skin. And but remember, belladonna is only useful when there is sudden and there is violence of attack. So yeah, that is a case when you can think of belladonna. Here I would like to end by giving a small explanation. I have interchangeably used terms like abscess and boils, though the presentation is different, but the mechanism is involved in it somewhat similar. Boil or furuncle is said to be the infection of the hair follicle, which is very 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 more painful comparatively to the abscess, whereas abscess is said to be a collection of pus in the closed cavity lined by a granulation tissue. It can be found anywhere in the body. So, though the presentation is different, the mechanism is one and the same. That's why I've interchangeably used those two terms in the description of the suitable remedies for such condition. Don't get confused. Hope I made it clear, like what was my intention in using those terms interchangeably. As the physiology or the pathology involved in its formation is something same, I've used them interchangeably. And yeah, that's all about homeopathic therapeutics for abscess. Hope this podcast was helpful, and keep watching this space for more such informative videos about various homeopathic therapeutics and description of drug pictures from different materia medicas. Till then, have a great day. Bye.